Okay, guys, this is Arthur Sugar. I've been knowing Sugar for a couple of years. I've been on her show. She's an extraordinarily great person. You can tell by the blue hair. Everybody can't pull off the blue hair. Arthur Sugar, are you there? Can you hear me?
I can hear you. I can hear you.
All right, all right. So we're live right now, Bio Bootcamp. We have over 20 speakers. Everybody is focused on something else. I know you do a lot of massage. What you got for us today as far as what's going on with massage and really getting healthier and better, especially during this time?
Well, thank you for inviting me. It's wonderful being here with you, as always, Mr. Visionary. And
Thank you.
what I'm wanting to relay to the people is that during this time, this pandemic, this COVID-19, there's so much stress. Additional stress is added on to every family member, even the children. Now, I have a massage business, and what I have had to do is I've had to actually reevaluate the way I do massages and what I offer in this time because people that have high blood pressure, diabetes, those are types of people that shouldn't get like the hot stone massage or they shouldn't
Mm,
be getting the deep tissue massage. So make certain that if you get massages that you let your massage therapist know your health condition. Other than that, from an infant to a 90-year-old, massage releases the stress.
mm,
Massage brings up fresh blood, fresh oxygen to the brain, so the brain can send the sensors back to the area which is in pain, whether it's your head, your back, your neck, your calves from exercising and walking or from running, working out. Now, if you work out and your muscles get sore and tight, don't stop working out, get a massage. If you have
mm.
back pain, don't succumb to all the pills on the market. Try a massage. This is what I say: pray first, get a massage, then do the drugs. Because
Right,
of the
okay.
side effects of the drugs, you're going to end up having to get a massage anyway. So pray, get a massage, then use the drugs. And there's no side effects with a massage but relief. That's the only side effect.
You know what? You
It's
bring up a
relief.
good point that right now is a very stressful time in a lot of people's lives. There's a lot going on right now. It's fires going on, it's a COVID virus going on. People are stuck in the house. I'm stressed out. I got my kids at home because they ain't used to working from home for school and the whole nine, and I work from home. So, that stress, what does stress do to your body that really is relieved through the massage?
Stress is the silent killer.
Mm.
What does it do? It adds the stress to the heart, to the
Mm.
liver, to the lungs, to the respiratory system, your muscular system, your digestive system, your reproductive system. So, stress, as I said, is a silent killer. And when you are restless, when you're in a situation like we've been put in since the beginning of the year with everyone at home, some
Yes.
people, their relief was going to work. Some of the children, their relief and food was going to school. Some of the
Right.
husbands, there was relief getting out of that house. But
Hmm.
when you're all in that same place, I would like to show you how you can make a massage table out of a regular table or just make a mat on the floor. And the husband can, I'm coming out with some videos where the husband
Okay.
can massage the wife can massage the husband, and the children can get massages as well. Therapeutic massages. But that stress, it will cause you not to sleep. That stress will cause diarrhea or constipation. It will bring your libido down. It will
Mm.
add other mental issues can be enhanced by stress. So you're taking the pills aren't working. You're starting with the alcohol's not working. You go to another drug by increasing the drugs prescribed by the doctor. And it's a big circle. It's a big circle that we deal with that stress. It can cause eyesight problems. It can
Mm,
cause you to have TMJ. So there's a
mm,
lot. Your hearing, constant headaches, and then just
right.
the pain and the tightness will make you feel, this is stress I'm talking about, will make
Sure.
you feel like you're having a heart attack.
Right.
But now getting a massage, it's not always painful if the massage therapist knows what they're doing. And you have to be truthful. You can't have taken a bunch of pills and then try to get a massage and expect it to work. It's not
Right.
like a chiropractor. I'm not, you don't crack your bones and do all of those sorts of things. You're manipulating the muscles, the tissues. You're causing oxygen to go into the brain to where you have fresh oxygen and blood flow to go to that area that hurts.
Mm. Now we talked earlier, and you talked a little bit about high blood pressure, cholesterol. Those things are affected by massage as well, is what you're saying?
Massage can help to relieve osteoarthritis, cancer, fibromyalgia, depression, anxiety, and just general pain like your back pain. But yes, it can, because what you're doing is calming the body down.
Mm,
Once you can calm the body down and put it in a state of relaxation, then you can go and proceed in manipulating the muscles in the body and bring that hypertension down. You've got to increase your water no matter what. You've got to increase that water so the muscles don't tighten back up.
okay. All right. So increase your water. So let me ask you this. What type of massage do you specialize in, or massages do you specialize in?
Well, because of the fact I've been massaging since, like I tell people, since I was 5 years old, my grandmother would come home from work and she said, "Oh, Granny's feet is hurting her." And I would massage Granny's feet and she paid me a quarter.
Oh, wow. So you've
My
been a
grandmother,
professional for a long time. I, I hear professionals get paid for their work. So you got a quarter. So you've been a professional for a long time. Okay.
I'm getting paid professional. And Granny lived to be 98 years old. And I
Mm.
gave her her last massage before she passed. And
Oh,
so,
wow.
yeah, yeah. And I never charged her all throughout all the years, but she
Yeah.
always had a way to put something in your purse or your wallet or a book or in a coat pocket in your closet. And you go and you get in your closet. Man, I done found this money. And Granny done put it in there.
Right,
So,
right, right.
but anyway, there's the deep tissue massage.
Okay.
There is the Swedish massage. There's a clinical massage, and
Hmm.
there's a sports massage, and then the prenatal massage. And when you go to school, you learn all of these types of massages that I just mentioned, so you can become an expert. But there's specialty massages as well, where you go and you pay additional money and take additional classes. So professionally licensed professionally massaging as an adult was in 1972.
All right.
So,
Well,
like, what's the difference between a Swedish and a deep tissue? Well, a Swedish is one that you basically will use just longer strokes, not digging into the skin at all, manipulating the tissues, and you work in a circular motion, a kneading motion, long strokes, and a little vibration. That would
okay.
be like your regular Swedish massage. And then
Okay.
the deep tissue, you're working slower to go deeper into that muscle without bruising it. Now, when I
Mm,
was at the spa for St. Louis in Galveston, there was a massage therapist there that if she didn't bruise you, she didn't do a good job. And there was
right.
like really a lot of complaints. And that was in 2000. There was a lot of complaints about the people, later on that day, or, later on that evening, having bruises. And
Mm,
so, if you're being bruised, it's too much pressure and you're not warming up the tissues. Just like before a football game, a basketball game, cheerleaders, you do warm ups before it, even a walker or a jogger, they're to do
right,
warm ups to
right,
warm the muscle so they don't bruise it or overstretch it, because then you
right,
have to call a massage therapist. Then you have to call me. Now we have
right,
the clinical massage, and the clinical massage is one of the massages that I really specialize in because lymphedema, and that's people that hold and retain water and their legs are really huge. I know everybody listening to this have seen someone in Walmart or Kmart or Dillard's that's had excessively large legs. If they
right.
would have started, if their doctors would have started them on lymphedema, lymphatic drainage system is what it is, lymphatic drainage. And that's to work the fluid back through the body, back through the system, and then they eliminate it. But if they don't, they just hold it there. They take water pills, and after a while, it's just really a painful situation. So I have
Mm,
3 clients that I do that particular clinical massage on. Now, if you have children that have been molested, abused, or any sorts of that may have ADHD, but more so those that have been abused, sexually abused, physically
okay.
abused. The specialized massage will teach them, with counseling and everything, but this would be
Yes.
part of their counseling, good touch. Because,
Got
see,
you.
all they know and can relate is love means hurt.
Right,
That's what they
right,
do up here. So
right.
it takes a moment, usually 6 months to a year on some of
Mm,
them, is to be able to really, can I get a hug today? And a lot of them, because hugs mean hurt.
right,
And you have to
right,
go in, and it's psychological evaluation that you get from the caseworker so you know exactly what you're dealing with. And no time at all do you remove their clothes,
right. Okay,
no time at all. And
okay.
so it's just that's what a specialized, clinical massage would be. Then again, the sports massage, dealing deep down in those muscles, pulling and stretching and flexing and more stretching to keep them up. And then you have the prenatal, which is prior to the baby, during the pregnancy, and then after. And then I go
Right.
into infant massage, geriatric massage. That's another clinical type massage.
Okay. All right. All right. Well, you know what? You a lot of times people are just thinking all massages are the same.
Mhm.
Breaking it down and showing the benefits to each one of those massages is very helpful. But you and I have something that we're working on together. Everybody's been talking about it on here, and you just got started with me. Can you lift up your bottle and show that you're part of the allegiance? Boom. Sugar's part of Justice League. Sugar. So you know what? You saw this. You said you were familiar with HGH, that you were familiar with it, and that you know what it does, and it helps people the same way that massage helps people on the cellular level as well. Can you talk about it for me a little bit?
Well, using the gel, which again, I'm just getting started in it, but I am very familiar with it, goes deeper into the layers of the skin.
Mhm.
Something that would be kind of comparable to what this is, it would be like a biofreeze. Some of y'all may not have ever heard of biofreeze, but it's what we use as a massage therapist that goes down into the sub layers of the skin, because you have your epidermis and your dermis layer of the skin. So it goes
Mhm.
down into that to where it will relax the muscle and take the pain away so you can massage, or using it until you can get to the massage therapist would work as well. But a lot of times we have right across here, because why? We're at a computer all day.
Right.
looking
Right.
down at a computer or looking up. And this that's back here. And what I like about this is the way that it comes out. The container itself, the way it comes out, and see, it's not runny, it's not
Right.
dripping.
Right.
You
And you
see
put it
that?
into the
You rub it
thin-skinned
together,
areas. Put it
and
into
then
the
you put it in
thin-skinned
the
area. Yep,
area.
exactly.
And that's something that you can actually do to yourself, and you don't have to have anybody. And it's so cool. It's really refreshing going
Right.
up odorless. So if
Right.
you're at your job, you don't have to feel like you're at a nursing home or feel like it doesn't
Right.
have an odor, a scent of it all. So I'm excited about
All
being
right.
able to introduce this to my clients. My
Yes.
elderly, I do a lot of geriatrics. So this
Yes.
would be something that they would be able to use, as well as my professional people. And it's a small enough container.
Yes.
It can go right into your purse, ladies. And whenever that pain might hit you, your calves, especially the people that I have that's into the working out and going to the gyms, that would be
Yeah.
something great until you can get to the massage therapist. But it dries, it's not sticky, it's not gummy. You don't have to run and
Absolutely.
wash your hands off. So I'm
Right.
excited about it.
All right. Well, I'm glad to have you. So for the people that are watching right now, if they wanted one of those massages or a free consultation from you, how can they contact you, Sugar?
You can call me at 409-333-9006. That's 409-333-9006. I'm also on Facebook, author Sugar Trask, or you can go to my website, which is, will you share my website?
Yes, absolutely. Absolutely. I will definitely share the website. So we got big things popping off the Sugar. I want to thank you for coming, being a part of Bio Bootcamp. You too will be a part of the book. Love the fact that you're part of Justice League. If you're watching this right now, you are watching something that's never been done before. This is a health summit with so many different people, from surgeons to doctors to pharmacists to massage therapists. So much information right here and so much more information coming. We'll be back after a moment. Say bye, Sugar.
Bye bye.